The coronavirus continues its rapid spread, impacting the global supply chain. Not only that, we've now seen travellers cancelling their flights. Some people are staying locked up in their homes to reduce the risk of catching the virus. The COVID-19 scare is no doubt affecting day-to-day life. For more on the social impact of this virus, I'm joined via Skype by political and social analyst Tessa Dooms. Tessa, thank you very much for your time this afternoon.
Good to have you. Yeah.
Right, so Tessa, we already live in a time where face-to-face social contact has been replaced to a large degree by digital interaction on social media platforms. And now the spread of the coronavirus threatens to further limit social interactions as people defer travel plans, avoid physical contact with one another, and stay home as a means of reducing risk. Is this virus likely to have a long-lasting impact on the way we interact with each other, or do you expect it to be short-lived for as long as the virus is active?
Yeah, I think there are a few things that we need to be concerned about at a social level. The first is bias and stereotyping. And so there are definitely people of particular nationalities, of particular ethnic groups, racial groups, even class groups who are being profiled negatively around the virus and being othered as a result of it. And so people have a heightened fear around particular kinds of people, regardless of what they know about those people. And I think what's been clear about the coronavirus, even from not only our government, but governments around the world, is that they're saying that you have to have very particular traits and activities to actually even be somebody that's worth considering. And so we should avoid having kind of a very superficial lens for who might be infected or not. And not just see people and profile them and run away from them. I think that's one of the things that we need to curb, because that can have a long-lasting effect. But I think another thing that's particularly important is that a virus like this depends a lot more on what we do in terms of our own personal hygiene and our own behavior, rather than worrying about what others are doing, right? So because things like washing your hands and not touching your face all the time, for instance, is something that would already curb the spread of the virus. It's important that we realize that we can't control what other people do, but this virus depends a lot on what we can do personally. And so othering others and deciding that you don't want to spend time with other people is not necessarily the best way to combat this. The best way to combat this is about monitoring your own behavior, your own hygiene, your own sensitivities around things, as opposed to trying to figure out who might give it to you. It's about not contracting it, and particularly in big crowds. So things like malls. Malls are actually, you're going to be passing people by a lot, and passing can't give over the virus as much as contact can. So there are limited ways we can get it, and we need to be mindful of our behavior as opposed to looking for danger from outside.
Yeah. So Tessa, physical contact is one of the things I want to look at. People touching each other is part of natural life. It's good for us. It releases oxytocin. But if people are scared to touch each other and avoid physical contact, I mean, we've already seen a decrease in shaking of hands. We've seen the development of, I think, what they call the Wuhan shake, where people are touching each other's feet, or sort of bumping feet as opposed to shaking hands as a way of greeting. What kind of impact is that going to have on how we feel? I mean, I can't imagine going for the next 2 months without hugging people.
Yeah, again, that speaks to our own habits and what we're doing with ourselves. So, for instance, the more hygienic you are in terms of washing your hands constantly, the better chances you have of not catching it, not just not transmitting it. So we need to have that in mind in terms of who we're engaging with or not. But also that people who have gone to particular areas where the virus are much more likely to be passing it along. And so we don't have to have those behaviors with all people all the time. Yes. We need to be cognizant of who we're around, get as much information about people who've been traveling, who've been in contact. The government is also providing a lot of information, background information, to the people who are confirmed. And so I think we must have a good balance between not having any contact with each other whatsoever, vis-a-vis being mindful of who we have contact with and what their particular histories are. This is going to be about understanding people's particularities, as opposed to just saying generically we're not going to touch each other anymore. I mean, it becomes much more difficult when you think about things like children and family. You can't really make those kind of outright rules within a family, yet we know that family would be one of the places you would contract it because of your proximity to your family and sharing homes. So I don't think we should make blanket rules about touching, but be way more cognizant about knowing the histories as much as we can of when we touch and who we touch. And in society, we don't generally just walk around shaking everyone's hand. And so when you get into contact with somebody whose hand you're going to shake, generally you know a little bit, and you can say when you're uncomfortable or not.
I'm glad you raised the issue of children. I wanted to address that. If coronavirus begins to spread between South Africans, so at the moment we're seeing it imported, and that's the first stages of the virus, but there is an expectation, and a very realistic expectation, that it could get to the point where South Africans would be transmitting that relatively commonly to each other. If it gets to that stage and we see the cancelling of neighbourhood get-togethers to minimise risk, perhaps weddings being delayed, family get-togethers being delayed, how are children likely to experience social interaction and the lack thereof? And what kinds of communication do we need to have with children specifically now around the coronavirus?
So, I mean, we've, as a family, in my own case, we've had conversations with children just around staying as healthy as possible. So the way you would in terms of winter and the common flu, you would say to somebody, stay as healthy as possible. And in this case, have heightened sense of hand washing, of hygiene efforts. And so to make children more aware of what they're doing than to make them scared of other people, I think is the main message you need to give to children. But even in terms of the way gatherings are conducted, I think, of course, the larger a gathering is, the harder it is to know who's in the room and to know how to interact. But even in those contexts, you really want to make sure that children aren't afraid. And I think fear would be a very stifling thing. You want children to know that they have some level of agency in terms of not getting ill in the way they would not when it's cold or flu season. So when you see somebody who has symptoms of a cold or a flu, that's already a sign that you should probably not interact with that person too much, but also not to make that person feel like they are uncomfortable or you are scared of them, because there's nothing to be afraid of as much as there is to be cautious.
So on that note of fear, South Africans have been told not to panic and that we should expect to see more cases and that the coronavirus is not a death sentence. Yet it's often referred to as the deadly coronavirus in the media. Has the media contributed to a sense of overall hysteria in South Africa?
So it's not only the media. Governments around the world have also contributed to this just by a dearth of knowledge. If we think back to the 90s and the HIV pandemic, one of the things that caused fear was both language like death and deadly being surrounded and thinking that you could scare people into good behavior. But on the other hand, there was just a dearth of information on the scientific facts. And I think the more government and the media put out some of the facts, the scientific facts, the better it is for people to not have the social panic and the moral panic that can come with this. I think one of the scientific facts that has helped me process this is the question around how long people can have the virus without showing symptoms. That's why there's a 14-day, now people are talking about 21-day incubation period, because there is a period where you can have the virus and not show any symptoms. And that gives us a sense of hope that you're not going to get the virus and then die tomorrow. You can get the virus and people are recovering at rates that are very high because you can have the virus without it showing symptoms. And when it has symptoms, if you get treatment fast enough, effectively enough, you are able to recover. More than half of the people who have been infected globally have recovered without going to very extreme measures. And I think that's really an important message for the public to know, that this isn't a death sentence. It is a public health response that is needed, but it does not need to mean death and destruction. And our response to it is what's going to be the difference between it being something that's manageable and something that's deadly.
Right, thank you very much. Tessa Dooms, political and social analyst, speaking to us there about the social impact of the coronavirus.